Hey, welcome to EMS Office Hours. This is Jim Hoffman, and these are your Monday Minutes. Today, guys, we're going to continue on with the respiratory emergencies, and we're going to little focus on pneumonia. This isn't going to be that long of a session, but of course, before we start, I would like to say why this stuff is important. And of course, it's great for brushing up on some key information to help you pass your exams, right? But it's not just for your exams. It helps you build your knowledge base, make better clinical decisions out there in the field, and also interact with other healthcare professionals like doctors and nurses, and improve your call report documentation. So today, like I said, going to talk about pneumonia, and this is an acute inflammatory condition of the lungs. It can be bacterial, it can be viral, can be fungal. It's actually the fifth leading cause of death in people, especially elderly people. And it's a group of infection. It's due to many different sort of agents, right? So keep in mind when you're looking at this is, in essence, this is an infection of the lung, but it can lead to atelectasis, okay? So something to keep in mind with that. Now, we're talking about some assessment findings and some risks. When you talk about community-acquired versus hospital-acquired, the community-acquired isn't as severe as the hospital. When we talk about hospital-acquired, you get those pseudomonias, and they can be those gram-negative bacteria, which can be very difficult to cure, right? Some of the risk factors, of course, if you're a smoker, you're an alcoholic, if you're exposed to the cold, especially the chronic hypothermia patients, those homeless patients that are out there always exposed to the cold, that have a higher risk factor. Elderly has a higher risk factor as well. Even the young very young can have a higher risk factor as well. It can be age as well. And abnormal immune system, things like HIV, stuff like that, can also increase your risk of getting pneumonia or being able to be cured from it with basic antibiotics, okay? So when you're assessing these patients, guys, a lot of times they're going to have an acute fever. They'll see some chills, cough. The cough can be productive or non-productive. Maybe you might have some sort of a color to the sputum if if it is a productive cough, where it might be green, it might be yellow. They might have that pleuritic chest pain, and even crackles or rhonchi, okay, when you're assessing their lung fields, okay. Some of the management for these types of patients, guys, we're talking about airway support, of course, and oxygen. IV access, believe it or not, can help these patients, because when they got pneumonia and they're breathing rapidly, they are actually blowing off a lot of their reserve sort of fluid, okay? So rehydrating them via IV can be helpful, okay? Keep an eye out for sepsis as well, okay? These patients are getting fevers, a high fever, and they can lead them into sepsis or septic shock. You have to keep an eye out for that type of stuff. You want to try to reduce the fever, depending upon your guidelines, what you can and can't do for that. And sometimes even nebulized albuterol or some sort of a inhaled beta-2 agonist can help you with these patients. But again, you want to follow your local guidelines when it comes to that type of stuff, right? When administering medications and your treatment of your patients. And of course, keep in mind, guys, this is a very contagious type of disease, where you have to protect yourself as well and other people around, especially if they have a cough, where you might be exposed to that bacteria or viral infection as well. Okay, some stuff to think about, guys. So again, this was a kind of a quick episode, guys, not too in-depth today. Next week, we're going to get into the pulmonary edema when it comes to respiratory emergencies. In the meantime, guys, be sure to engage with me. I'm on Twitter and Instagram at EMS Save. You can check me out on Facebook as well at the EMS Professional. Be sure to go check out the main website at emsseo.com, and you can get some great resources there for your success and for your education to help you expand your opportunities in EMS. So go check that out again. That's emsseo.com. And guys, if you have some minutes of your own and some comments on today's episode or episode you want to see in the future, be sure to contact me. It's contact@emsofficehours.com. And check out the main blog at emsofficehours.com to go ahead and see previous episodes of the Monday Minutes, and also listen to the weekly podcast there. All right, guys, that's it for me. As always, I am Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.